is an epidemiologist and associate professor of health sciences at the University of Ottawa. Professor Deonandan, thank you for joining Crosstalk.
It's my pleasure.
What are your thoughts on the lifting of mask mandates at this stage in the pandemic?
I don't like it, and here's why. You're in a really good position right now, really low caseloads, probably the best in the country, I think, right now. So that means you have the luxury of doing something that others don't, and that is hardening yourself for what might be coming soon, rather than playing with what might be coming soon. So what we're facing in this next wave that is besetting the country is a tale of two characters. We have the villain, the Delta variant, and the hero, which is vaccination. And this villain is hyper-transmissible, as transmissible as chickenpox, which is scarily contagious. So it might even be the most contagious respiratory virus we've ever seen. That means it can tear through the unvaccinated population relatively easily. And even though it sounds like you've got a great vaccine uptake, it's not good enough. Maybe 2/3 of the eligible population have been fully vaccinated. That's what, a little over half of the total population. That is insufficient to render sufficient protection for the entire community. So my recommendation, if anyone cares what I think, would be to maintain the simplest, cheapest mitigation tool available. That's mask wearing indoors for that extra bit of protection to prevent the unvaccinated population from being an untoward burden on your healthcare system.
So in this province, it's still being strongly encouraged. And if you go out, like certain shops and stuff, if you go into some stores, they still have their mandates for the individual stores. Others don't. If you go to the grocery store, you'll see some people without a mask. I was in the liquor store the other day. Some people had masks on, some people didn't. But when you have an epidemiologist like yourself saying this, why do you think governments are making this move to remove the mask mandate when you're getting these statements?
Well, a couple of reasons. I think one is the thresholds for lifting restrictions is based on modeling done months ago when the Delta variant was not dominant, when the Alpha variant was dominant, and that has a lower transmissibility. So it makes sense, according to that modeling, to be doing this now, but it no longer makes sense. The second reason is I think everyone understands that mask wearing should be done, but the question becomes one of how to best encourage it. Is it to make it mandatory, or is it to nudge and coerce and incentivize people to do so on their own volition? And maybe those who understand their population better suggest that the second path is more amenable. Maybe that's true. I don't know. I do know that mask wearing should be done right now. The question is, how do you cause it to happen? Make it the law, or just make it highly recommended?
The news at the top of the hour there talked about the back to school plan, which was announced this morning, and they've got a couple tiers, right? They're saying it's risk-based for low and high risk transmission. So in September, if there's low prevalence, everything will start with a low risk designation, meaning full attendance instead of blended learning, 2 meters distancing not required, but they will limit crowds in hallways and things like that. Masking is acceptable and encouraged, but no longer mandatory. So this is pushing into the fall, and if numbers pop up, then they will move to a different level for high risk transmission, and rules will be changed accordingly. What do you think of that?
There's a lot of good there, and the best part of it is that there is a two-pronged approach, and there is a trigger to be pulled in the case of extreme community transmission. That's a great part of it. The second part is that it really understands that the single biggest threat to schools is community cases. If it's not in the community, it can't get into the schools. It sounds like right now the community levels are low enough that we can have a fair bit of leeway with how schools are run. So that's great. What is missing is the details, as far as I can see it, is things like surveillance. So are there symptom checks for students coming in the classroom? If you're symptomatic, you're far more likely to spread to others than if you're not symptomatic. Is there going to be some asymptomatic testing so we get a handle on what's going on? And how about ventilation? COVID is airborne. That's why it's so incredibly transmissible right now. The Delta variant spreads like chickenpox in the air. So unless there's a plan to improve ventilation with HEPA filters and water and air purifiers, then we're missing a big part of this. Otherwise, I like a lot of what I hear. But again, the devil's in the details.
Also at Memorial University this fall, masks will be encouraged but not required. There are some exceptions, for example, with wet labs and stuff like that. I've seen on Twitter over the last few days, there's been professors at the university who are worried about the fact that masks won't be required. What do you think in terms of the university level, where you have lots of students, lots of people, and also people from all around the world coming in to go back to school?
Across the country, the single biggest demographic with vaccine hesitancy or low vaccine uptake is the university age population. So that is likely where we're going to see outbreaks happen if and when they do happen. So it makes sense to focus some public health assets on that population, on that environment, the university environment. If you're not going to have a vaccine mandate for the university on campus life, at the very least, you need a mask mandate. One or both of those things should be in place, in my opinion. Now, keep in mind, Immunoflan is doing really, really well in containing COVID. What I hope is you continue to do it well, right? So the thing about exponential growth is when you see it, it's too late to act. So now that you don't see it, now's the time to put into place procedures to prevent it from happening.
And just before I let you go, just to underscore everything, if Professor Raywat Deonandan was in charge for, well, from now to the end of the pandemic of everything, what would you have in order to get us through safely as possible, through this Delta variant and out the other end of the pandemic?
We know exactly what needs to be done. We need to increase vaccine uptake and mitigate transmission until uptake reaches a certain threshold. That threshold is probably 85-90% of the population. So we incentivize vaccine uptake with vaccine passports, incentivization programs, making it mandatory for some professions and environments, etc., while keeping the cheapest, most effective mitigation tools on the cards, like mask wearing and limits on gathering size and improving ventilation. We do that for a few months, and guess what? We get to the end fairly effortlessly and without much suffering.
Thank you so much for coming on for this talk today. I know you're a busy man, so I'll let you go, but thank you again. Thank you for joining Crosstalk.
It's my pleasure. Thank you.
That was Raywat Deonandan, an epidemiologist and an associate professor of health sciences at the University of Ottawa. Do you have thoughts